news and sports, weather, and of course your commuter news before you head out, so you get everything you need to know before you go. And of course it's an early start for us to make sure that we get all our ducks in a row before we put them out for you to see. And also it's all about public service broadcasting, holding people accountable. That's what we do, because you can't. But we do that in collaboration with you through our interactive features on the show, where we hear from you through our question of the day and put your questions to the leaders of this country that we get to put on the show every day. So stay with us on SABC2 and SABC News for more Morning Live and everything you need to know before you go.
Welcome back. You're still watching Health Talk. Now, if detected early, prostate cancer has an enormously encouraging 5-year post-diagnosis survival rate, upwards of 95%, in fact. Unfortunately, this starts to drop to 29% if the disease has spread to distant parts of the body at the time of diagnosis. Now, David is a prostate cancer survivor, and he hopes that by speaking out about the disease, he may induce men to get themselves screened regularly. He shares his story with producer Wandile Mufokeng.
Mr. David Lucas, thank you so much for being on the program. Welcome to Health Talk on SABC News.
Good morning to you, Wandile, and to all your listeners.
Now, Mr. David, you are a cancer survivor. Before getting to how you survived cancer, maybe could you just briefly tell us when were you diagnosed with cancer and what type of cancer was it?
Right. Wandile, I am a prostate cancer survivor, the type of cancer that mostly affect men, and particularly men over the age of 40. Younger men are normally affected by what is known as testicular cancer. I was diagnosed in 2011, and I must be honest with you, merely by chance.
What form of treatment did you undergo for you to survive cancer?
Wandile, mine, it differs from people, but I'll add on as well. But my situation was, after the biopsy and, a diagnosis of cancer, I then went on and did what they call brachytherapy. Now, it's a very simple thing that they do. The doctors put you under anesthetic. They put, I would call it, for the sake of viewers, I would like to just call it little seeds, radioactive seeds implanted in your prostate. And these seeds then releases the radioactivity, and that kills the cells within the prostate.
Now, could you also maybe kindly tell us, within your cancer journey, have you ever been on remission? How many times were you in remission?
I'm presently in remission. It has taken some time, since 2011 and the beginning of 2019, 2020. With this COVID, we tend to forget dates and things, because it's like 2020, that year has just passed and gone away. But yeah, I think it was beginning of 2020 or 2019 that I have been cleared. I still have to go for regular checkups, at least once every 6 months.
What lifestyle changes did you have to do to make sure that you do not invite cancer back into your life?
We must be realistic that in many cases we live a life where we can unfortunately invite those things. Argument, smoking, excessive alcohol or alcohol abuse. These are some of the factors that's there. But I do not see the reason why I should become, as the people call, the gym junkie. Now suddenly, I live in the gym. Suddenly I can't do anything. I must eat X, Y, and Z food. Technically, I eat basically anything.
Your words of encouragement to someone who is living with a particular type of cancer, what would your words of encouragement be to those who want to give up or take their own lives, seeing that they are not getting rid of cancer? What would your last words of encouragement be?
As a male, you also understand, and most males, we have friends and we talk. Virility and sexuality is always one of the talks that we have. one of the things we discuss, and one of the worrying factor why men are scared to know whether they have cancer, and particularly prostate cancer. Meneer, again, if you are diagnosed early enough, you will not have a problem with sexual function. You will be able to still carry on. You need to ensure that you do that early enough so that that doesn't happen.
Now, the Cancer Association of South Africa, CANSA, recognises the courage displayed by those affected by cancer as they go through diagnosis, treatment, and as well as the side effects and the benefit of support throughout this journey from fellow survivors. Now, they're looking for you to help collect at least 90 stories of hope as part of CANSA's 90th anniversary of fighting cancer through research, education and support. And to speak to us a little bit about Cancer Stories of Hope, hashtag CANSA90, we're now joined by Professor Michael Herbst, who's the Head of Health at CANSA. Prof, thanks very much indeed for joining us and welcome to the programme.
Thank you very much.
All right. I love the idea of hashtag CANSA90. Talk to us a little bit more about this. What are you trying to do?
Well, you know, I think it's really important that we get the message across to everybody that CANSA, the organization, has been around for 90 years. We're so blessed because we know during the hardships, we've seen that fellow NGOs, some of them have had to close their doors, and because of financial implications. And God has been good to this organization. We're still going strong, even in our 90th year, and we want to share this with every citizen within South Africa, because cancer is really on the increase. The latest statistics tell us that there were more than 82,000 people diagnosed in 2017. And I can tell you that the figure for 2021 is going to be far in excess of the 82,000 that we saw for 2017.
All right. So these stories, what do you want them to tell? What are you hoping that they will do?
Well, we trust that people will share with us that cancer is not necessarily a death sentence. There is treatment available for people who have been diagnosed with cancer, and there's excellent treatment available in South Africa. I can tell you that I have a little bit of hesitation at all to say that South Africa has of the best oncologists, those are cancer specialists in the world, and we provide everything that any other country in the world can provide to cancer patients, and especially to cancer survivors. And we want to celebrate each day with every cancer survivor in South Africa.
Within CANSA, your association, what sort of programs are there for survivors of cancer?
Well, you know, if we look at how we define a cancer survivor, and we say that everybody who's been diagnosed with cancer and is still alive is a cancer survivor. And for people like that, we provide support not only for the person who's been diagnosed with cancer, but also their loved ones. Because we must remember that if there is a single individual within the family that has been diagnosed with cancer, the diagnosis affects every member of that family. Because there's always other people who have a loved father, a mother, a brother, a sister, an uncle, an aunt, or whatever other relative, and even a good friend that has been diagnosed with cancer. And we want those people to be around us for as long as we possibly can have them, and provide them with the best quality of life and the comfort and support that they so deserve.
I suppose there's a lot of anxiety when you first get diagnosed, and this carries on throughout treatment. But, you know, maybe people don't say it too much, but post-cancer, there's always also that fear, isn't there, that they carry that, oh my goodness, it might come back.
Yes, I think that is something that is in the back of every cancer survivor's mind. And that is why we provide them with the support that they deserve and information. For instance, go for your continuous screening that you need to go for. Don't stop with screening. Visit your doctor regularly and still continue to practice all the cancer-reducing practices that we have, like do not smoke, avoid alcohol, go for your regular screenings, which I've already mentioned, eat a healthy diet, try and avoid highly processed foods as much as possible. Maintain all your vaccinations because those are really crucial. Reduce the intake of red meat. Stay out of the sun from 10 o'clock in the morning till about 3 o'clock in the afternoon. And then use sunscreen when you go out into the sun to protect your skin. Because we know that there are thousands of people diagnosed of all skin tones in South Africa diagnosed with skin cancer every year. Maintain a healthy weight, because obesity is one of the problems that assists in increasing inflammation in the body and increases the risk of cancer. And then to be physically active as possible and to avoid risky behavior. And I think that's sort of the crux of the matter that we want to say to cancer survivors so that they can reduce the fear of cancer coming back.
And that list, everything that you mentioned, I mean, that's for everyone really, isn't it? And that's to help prevent.
Absolutely. This is the recipe for reducing the risk of cancer. And especially so for people who have a fear, that we just continue reminding them that these are the things that are available and that we as individuals can have control over.
Yeah, and I suppose there's nothing more powerful than testimonies, and why the stories thing is important, because sometimes people get hope by listening to other people's stories of survival.
Absolutely, you know, this is why one of the services that we provide, and it's really been on a little bit of hold at the moment with COVID-19, are the support groups that we have. But we still have some support groups on WhatsApp groups. And this is so important that people then support each other and that they can share their testimonies, that they can share their stories of hope and their stories of what do I do to assist myself and to keep strong. And one person keeping the other strong is really a wonderful opportunity for everybody to participate in.
What kind of cancers have you seen? I mean, you're saying that there's been an increase. Which ones in particular are you seeing are happening more and more now?
Well, let's look at the latest statistics. Then I can tell you for men in South Africa, the top 5 cancers are prostate cancer, colorectal cancer, you know, and this is something that we didn't see a few years ago. It was really one of the rarer cancers. It is now cancer number 2 amongst men. Then lung cancer and non-Hodgkin's lymphoma, and the 5th one is melanoma. For women in South Africa, breast cancer number 1, cervical cancer number 2, then also colorectal cancer is number 3. Then cancer of the uterus and lung cancer. And really, we must also then remember that even though breast cancer is number 1 for all women and cervical cancer number 2, when we look at the population, the African population in South Africa, those two swap positions. And for black women, cervical cancer will be cancer number 1 and breast cancer will be cancer number 2, and the rest stays the same.
All right, and bottom line, lifestyle changes, good weight, good diet, exercise is going to help every single person to meet some of these challenges.
Absolutely. And the final message, anything that's different in your body today than it was last week or last month or last year, have it seen to, have it investigated, because an early diagnosis means early treatment and it provides a better future for everybody.
Professor